For most people, a visit to the doctor is usually a matter of just a simple checkup. But for the medical personnel, the paperwork, along with medical records, can grow to astronomical proportions in a very short period of time. In order to facilitate this time-consuming process, healthcare providers, hospitals, and doctors' offices around the nation have begun implementing electronic filing.
Instead of going into a certain location to pull a patient chart and review it, now you don't have to do that. You just log into where you have this information and pull the electronic version of it.
Recent studies show that between 3 to 5% of claims submitted for processing are fraudulent. Electronic filing improves safety not just for the patients, but also for healthcare organizations. Also, it helps reduce errors, a major imperative of healthcare reform.
Some of the advantages are accessibility, organization, being able to find the information, and being able to make it presentable with fewer mistakes.
As part of the Economic Recovery Act of 2009, the federal government set aside funding for hospitals and doctors to convert to electronic filing by the year 2015. Yet in 2009, only 1 in every 50 hospitals has switched to a comprehensive electronic filing system.
The fact that most healthcare professionals are not technology savvy is going to stand in the way. So re-educating and training healthcare professionals in how to handle electronic medical record will be very, very important.
Medical e-filing has its critics, though. Some in the healthcare industry have expressed concern about organizations that are not covered by HIPAA gaining access to private patient records.
Most of the electronic filings nowadays operates behind so many layers of authentications. Firewall is just the beginning.
With new applications coming onto the market every day, technology will play an important role in the long-term success of e-filing. And for doctors and healthcare providers, the most important aspect to consider is not only how user-friendly the system is, but also how secure. To keep track of patients and treatments is a daunting task for a doctor's office or healthcare provider. The amount of time spent filing and classifying information can be enormous. As our nation's healthcare system turns to electronic filing to help solve the problem, Clinic Tools is a secure system designed to make it easier for healthcare providers to collect patients' health information, process it for treatment and payment, regardless of location and time. Clinic Tools is changing the way doctors' offices operate. Thanks to Clinic Tools, it's never been easier for a doctor to have access to a patient's medical history.
All the information is there at my fingertips because it's internet-based. I can change, modify, review all the documentation and share it with other healthcare professionals on the system.
Clinic Tools facilitates the sharing of valuable information with specialists and other professionals. Collaborating with any paraprofessional assigned to a patient has never been easier. A doctor can now open a new case, complete all necessary documentation, and verify a treatment with a supervising nurse to prevent errors. It also helps monitor productivity around the office for efficiency.
If someone else comes in for an emergency, that information is available to any person who treats that person.
The days of moving charts around are over. With the Clinic Tools system, access to a patient's medical history is just a click away. The system is 100% HIPAA compliant and guaranteed to meet the requirements of any regulatory agency. If you are a healthcare provider having problems with filing space or long processing hours, Clinic Tools is the solution. An easy-to-use system that keeps all records in one place and facilitates data processing and filing. Clinic Tools, a leader in electronic medical records of the future.
It's a lot easier to monitor the patient's appointment for scheduling and for patient follow-up.
It's basically broken down. Everything is simple and you see it as you go. Nothing is hard.
Well, Clinic Tools has made everything a lot easier. I can check my work in and out of the office, just as long as we have internet-based. I can check for errors and also send feedback to the clinician if necessary.
For more information, call 215-294-6790 or visit clinictools.org.